Welcome back YouTube to our Curious Cases Clinic channel, where we dive deep into the most puzzling medical mysteries. Today, we have a fascinating and a rare case to explore. This involves a 40-year-old woman, anticoagulation failure, and a diagnosis that will leave you on the edge of your seat. Grab your drinks and let's unravel this enigma together. Our story begins 6 months ago. A 37-year-old woman was diagnosed with a pulmonary embolism, a blood clot in the lungs that can be life-threatening. A pulmonary embolism, or PE, is a condition where one or more arteries in the lungs become blocked by a blood clot. Imagine your blood vessels as highways, and a pulmonary embolism is like a sudden traffic jam that stops blood flow. This can cause chest pain, difficulty breathing, and a rapid heart rate. The blockage usually comes from clots that travel from the legs, a condition known as deep vein thrombosis, or DVT. If not treated properly, a PE can be life-threatening because it prevents oxygen from getting to the lungs and other parts of the body. Our patient was put on anticoagulation therapy, or blood thinners, a treatment designed to prevent new clots from forming. But here's where things took a turn. Despite the treatment, her symptoms did not improve. She continued to experience shortness of breath, limiting her life. Alongside this, she had intermittent fevers and had lost about 5 pounds without trying. Her case was true head scratcher. Patient had a CT imaging done at outside hospital that showed a persistent or even slightly increased thrombus, which was an alarming sign. A catheter-directed thrombectomy was attempted but failed to remove the clot. She was then referred to a specialty vascular medicine clinic, and that's where our case really picks up. A catheter-directed thrombectomy is like using a tiny vacuum cleaner to clear out blockage in the blood vessels. A thin flexible tube called catheter is inserted into the vessels, and this catheter is guided to the site of the blood clot. Once it reaches the clot, the catheter uses a special tools or medications to break them up and suction them out. This procedure may help restore normal blood flow, reducing symptoms, and therefore preventing serious complications. When the patient presented to vascular clinic, she appeared very anxious. Her vitals were unusual. Her blood pressure was low, and her heart rate was in her 50s. Her cardiac exam showed a harsh murmur. A murmur is an unusual sound usually heard during the heartbeat, which can be caused by a turbulent blood flow through the heart or its valves. At that point, the patient's only medication was the blood thinner, rivaroxaban or Xarelto. Patient underwent further workup, including some labs. Her labs came back abnormal, including elevated proBNP, mild anemia, and elevated white blood cell count. ProBNP, or pro-B-type natriuretic peptide, is a substance produced by the heart. It can be used as a stress signal that can sometimes indicate heart failure. Patient underwent a CT angiogram, which showed an occlusive thrombus or clot in the pulmonary arteries extending into the right side of the heart. The thrombus was not just sitting there. It was causing right ventricular strain, a condition where the right side of the heart struggles to pump blood due to the blockage. Patient also had an echocardiogram that showed mass in the right side of the heart. Now let's take a minute to learn about the anatomy of the heart. The heart is an organ about the size of your fist, located in the middle of your chest. It has 4 chambers, 2 on the top called atria, and then 2 on the bottom called ventricles. The right side gets blood with low oxygen from the body, which it pumps to the lungs for oxygenation. The blood that gets the oxygen back comes back to the left side of the heart, which the left side of the heart pumps back to the rest of the body. There are 4 valves that ensure blood flows in the right direction, preventing backflow or leaks. So the heart works as a powerful pump, working 24/7 to help circulate blood and keep your body functioning. With all this information and failure of improvement on the blood thinner, there were different possibilities the doctors thought about. Perhaps non-adherence to medication, anticoagulation failure, or a non-thrombotic mass like a tumor. So the doctors had to dig deeper. She underwent a special scan called a PET scan, positron emission tomography, which showed abnormal metabolic activity in the right ventricular outflow tract, consistent with a mass or a tumor-like process. A PET scan is a type of imaging test. During the test, a small amount of radioactive glucose is injected into the body. A special camera then detects the radioactive signals and creates detailed pictures of the inside of the body. These images can show areas of high activity, which can correspond to different things such as cancer or inflammation. Our patient also underwent other tests such as pulmonary function tests and 6-minute walk test. All these tests were abnormal. So the patient's symptoms, along with the information from these tests and the persistent mass in the heart, led the doctors to suspect a rare but serious condition, something called primary cardiac sarcoma, a type of tumor originating in the heart. So the decision was made to take her to the OR and perform surgical exploration. During the operation, the team encountered a mass in the pulmonary artery, which pathology confirmed as sarcoma. Surgery was complex, involving cardiopulmonary bypass and removal of part of the lung to ensure complete resection of the tumor. After the surgery, our patient began chemotherapy. 6 months later, her echocardiogram showed normal heart function, and 3 years follow-up showed that there were no signs of metastasis. This case highlights the importance of considering rare diagnosis when common treatments fail. Primary cardiac sarcoma is incredibly rare, with less than 250 cases reported worldwide. It's a type of cancer that arises from the muscles and is often mistaken for other conditions such as pulmonary embolism. This needs to be considered in cases of apparent thrombi not responding to anticoagulation. Our patient's journey from a seemingly simple blood clot to a complex cancer diagnosis underscores the importance of thorough investigation and persistence in medicine. Thank you for joining us on this episode. If you enjoyed this episode, do not forget to like, subscribe, and hit the bell icon for more intriguing medical mysteries. Until next time, stay curious and stay healthy.